Start. Tackling drug trafficking and substance abuse issues is a significant challenge in India, as the country grapples with a growing drug menace that threatens public health, security, and societal well-being. The geographical positioning of India makes it particularly vulnerable to the illicit drug trade. It is sandwiched between two major drug-producing regions, the Golden Crescent, comprising Afghanistan, Iran, and Pakistan in the northwest, and the Golden Triangle, including Myanmar, Laos, and Thailand in the northeast. This positioning makes India both a destination and a transit route for drug trafficking, leading to a complex web of challenges that law enforcement and policymakers must address. The scale of the drug problem in India has been highlighted in various government reports and studies. A survey conducted by the Ministry of Social Justice and Empowerment in collaboration with the National Drug Dependence Treatment Center of the All India Institute of Medical Sciences (AIIMS) revealed alarming statistics about the prevalence of substance abuse across the country. It showed that millions of people in India are dependent on various substances including alcohol, opioids, cannabis, and inhalants. The use of synthetic drugs, such as methamphetamine, has also seen a sharp increase, particularly among young people in urban areas. Drug trafficking networks in India are highly sophisticated and often involve international and cross-border elements. Traffickers exploit India's porous borders and use innovative methods to smuggle drugs into the country, such as concealing narcotics in shipments of legitimate goods or using mules to transport drugs across state lines. The use of dark web marketplaces and encrypted communication channels has further complicated efforts to combat the drug trade. Law enforcement agencies, including the Narcotics Control Bureau (NCB), the Directorate of Revenue Intelligence (DRI), and various state police forces, are engaged in a continuous battle to intercept drug consignments and dismantle trafficking networks. One of the primary strategies in combating drug trafficking is strengthening border security. The Border Security Force, BSF, the Indo-Tibetan Border Police, ITBP, and the Assam Rifles are tasked with patrolling India's borders and preventing the smuggling of narcotics. These forces use a combination of traditional methods, such as border checkpoints and patrolling, and modern technologies like surveillance drones and advanced scanners to detect and intercept drug shipments. Despite these efforts, traffickers often find new routes and methods, necessitating constant vigilance and adaptability on the part of law enforcement agencies. Collaboration with international agencies such as Interpol and the United Nations Office on Drugs and Crime (UNODC) has also been crucial in tackling cross-border drug trafficking. India has entered into agreements with several countries to share intelligence and coordinate operations against drug cartels. Additionally, regional forums like the South Asian Association for Regional Cooperation (SAARC) provide platforms for member countries to discuss and implement strategies to combat drug trafficking. However, enforcement alone cannot solve the problem of substance abuse. Addressing the root causes of drug addiction and providing support for those struggling with substance abuse are equally important. India has launched several initiatives to promote awareness about the dangers of drug use and provide treatment and rehabilitation for those affected. The Ministry of Social Justice and Empowerment, in collaboration with various NGOs and civil society organizations, has been at the forefront of these efforts. Programs like the National Action Plan for Drug Demand Reduction, NABDR, focus on prevention, treatment, and rehabilitation. They aim to create awareness through educational campaigns, establish the addiction centers, and provide skill development and employment opportunities to rehabilitated individuals. Education and awareness campaigns are crucial in preventing drug abuse, particularly among young people. Schools and colleges are increasingly being targeted for awareness drives, where students are educated about the harmful effects of drug use and the long-term consequences it can have on their health, future, and family life. Celebrities and influencers have also been roped in to spread anti-drug messages, leveraging their reach and influence to connect with the youth. Treatment and rehabilitation services are an integral part of tackling substance abuse. India has a network of day addiction centers run by the government and non-profit organizations, but there is still a significant gap in terms of access and quality of care. Many rural areas lack proper facilities, and the stigma associated with drug addiction often prevents people from seeking help. To address this, the government has been working to expand the reach of day addiction programs and integrate them with community health services. The role of the judiciary and the criminal justice system in addressing drug-related offenses is another critical component. While it is necessary to punish drug traffickers and distributors, there is also a growing recognition of the need for a more rehabilitative approach toward drug users. The Narcotic Drugs and Psychotropic Substances (NDPS) Act, which governs drug-related offenses in India, has provisions for the treatment and rehabilitation of drug addicts. However, experts have called for reforms to ensure that users are not criminalized, but instead provided with the support they need to recover and reintegrate into society. The emergence of new psychoactive substances, NPS, and the growing use of synthetic drugs have added new dimensions to the drug crisis. These substances are often cheap, easy to manufacture, and difficult to detect, posing a significant challenge to law enforcement agencies. In response, the government has been updating the list of banned substances and working with pharmaceutical companies to monitor the production and distribution of precursor chemicals used in the manufacture of synthetic drugs. Tackling drug trafficking and substance abuse in India also requires a community-based approach. Grassroots organizations, religious groups, and community leaders play a vital role in spreading awareness, supporting affected individuals, and creating a supportive environment for rehabilitation. Village councils and local bodies can also act as first responders, identifying at-risk individuals and facilitating interventions before substance abuse becomes a full-blown crisis. In conclusion, the fight against drug trafficking and substance abuse in India is a multifaceted challenge that requires a coordinated approach involving law enforcement, healthcare providers, policymakers, and the community. While significant progress has been made in intercepting drug shipments and dismantling trafficking networks, there is still a long way to go in terms of prevention, treatment, and societal change.